Hello students, I am Baljit here from Department of Pharmaceutical Sciences, GPCG Patiala. I am here to deliver the lecture on insulin and oral hypoglycemic agents. They are used in the treatment of the diabetes. So, I will be taking up all the drugs of the orally taken drugs and the insulin, which is mostly taken by injectable. First of all, I will talk about the disease for which both insulin or these oral hypoglycemic agents can be used. Diabetes is basically of two types, that is diabetes mellitus and diabetes insipidus. But since we are talking about the sugar level, so I will be just taking into consideration the diabetes mellitus. It is a syndrome of disordered metabolism due to the combination of hereditary as well as the environmental causes. This diabetes mellitus has been classified into two types, that is type 1 due to the lack of insulin, or the students are much more familiar with the terms like IDDM, that is insulin dependent diabetes mellitus. Or it is a type 2 type of the diabetes mellitus where cells resistant to insulin, that is NIDDM, that is non-insulin dependent diabetes mellitus. The different signs and symptoms that you come across before getting it checked. So, it is not always that a person gets it checked and comes to know that a person is suffering from diabetes mellitus. Certain type of the symptoms, they also give an indication that there is a problem. And what are the symptoms? What are the signs? A person must be feeling very thirsty, very tired, using the toilet often to urinate, constant hunger, high level of sugar or glucose in urine and in fasting blood, which can be only detected by certain tests. The complications that we come across in the diabetic patients depends upon the type of the problem. It can be acute, it can be chronic. Acute means the problem that we come across is diabetic ketoacidosis, that is DKA. Non-ketotic hyperosmolar coma. It can be chronic, where you have a microvascular disease, that is the impotency, and the poor wound healing. This is the main indication that we see in the diabetic patients. That is why before carrying out any surgery, a person has to go in for the test of the sugar. But then only a person will come to know, a surgeon will come to know how long it will take for a person to heal, or what will be the complications after the surgery. Atherosclerosis, there can be strokes, coronary heart disease, renal heart failure, kidney damage, retinal damage, nerve damage. There can be the infective disease like that of tuberculosis. If a person suffers from diabetes, that is a diabetes mellitus, we have to look in for the treatment. What are the treatments to be followed? If a person is suffering from type 1 diabetes mellitus, that is insulin dependent diabetes mellitus, this insulin must be injected or inhaled. In type 2, food control has to be exercised, the exercises have to be done, and the proper medicines have to be taken. So, the conditions can be the agents which increase the insulin secretion, we have to take those things. Agents which increase the sensitivity of the target organ to insulin, go in for this. Agents which decrease the glucose absorption, and fourth is insulin that is needed for the patients with serious complication, or directly we give them insulin. What is insulin? Insulin is made up of, talking about its chemistry, it is made up of 51 amino acid. They are arranged in two chains, A and B, linked by disulfide bridges. They are secreted by the beta cells of Lyell of Langerhans in the pancreas, can be degraded both in liver and kidney. Its endogenous degradation we find In liver there is 60% degradation, and in kidney it is 35 to 40% degradation. Exogenous, liver 35% to 40%, kidney 60%. Plasma half-life is just 3 to 5 minutes. Its physiological and pharmacological actions we have to take into consideration 3 of them, that is sugar metabolism, fatty metabolism and protein metabolism. Coming to the first, that is sugar metabolism, it stimulates the glucose uptake and use by the cells, that is inhibits the gluconeogenesis, that is the blood sugar. In fatty metabolism, it improves the fatty acid transportation, and fat anabolism inhibits the fat catabolism and fatty acid and acetone body generation. Regarding the protein metabolism, improves the amino acid transportation and protein anabolism, inhibits protein catabolism and amino acid utilization in liver. So, physiologically it is acting on 3 of the metabolisms, that is sugar, fats and the proteins. Coming to the adverse reactions of the insulin. Insulin allergy is seen like itching, redness, swelling, anaphylactic shock. There can be a resistance to insulin, that is insulin resistance. There can be hypoglycemia like nausea, hungry, tachycardia, sweating, tremulousness. So, in such cases first aid is needed while convulsions or coma happens. Lipodystrophy at injection sites, that is atrophy. Insulin has onset and duration of action, but it has to be controlled. Its absorption is to be controlled, its duration has to be controlled. The absorption rate of insulin from the subcutaneous site is very slow, because insulin molecules tend to form dimers, and in the presence of the zinc they form hexamers. But we know that only the monomers and the dimers, they are absorbed with any degree of speed. So, we have to be very cautious that these hexamers must be broken into monomers and dimers for the absorption. So, the dissociation rate is slow. Onset is about 30 minutes, duration is about 6 to 12 hours, which is much longer than the predicted one by the half-life of 4 minutes. I have taken into consideration few of the preparations, they may not be official, that is insulin lispro. Here we find, you just have a look at the diagram here, you find that there are 2 chains. This is the amino acid chain. So, the first chain, that is A chain, is comprised of 21 amino acids and B chain is comprised of 30 amino acids. So, total, as I just talked in my previous slide, it is made up of 51 amino acids. This A chain, we find that the linkage of the A with the B is done by this disulfide linkages. At the position 28 and 29, as mentioned here, that is B28 and B29, this is lysine and proline, they are exchanged at this position. Equilibrium shifts away from the hexamer. When we make such changes, the equilibrium is going to change, and thus enhances the rate at which it dissociates into dimers and monomers, and rate of absorption is increased. So, that is what is our aim. So, what we are going to do is, we have got the structure and we will make the changes in such a way in the position both in the chain A and the chain B, so that the equilibrium that is going to shift away from the hexamer hexamer, which is not going to increase the absorption rate. The dissociation takes place from the hexamer to dimers and monomers, and ultimately the rate of absorption that is going to be increased. Second preparation talking about is insulin aspart. It is substituted for proline at B28. Have a look here. A chain made up of 21, B chain made up of 30, linkages by the disulfide. Coming to this position, 28. So, it is the aspartate that is being substituted by proline. When such changes are made, again the equilibrium is going to shift away from the hexamer formation, and that reduces the tendency to form the hexamer, or it increases the tendency to form the dimers or form the monomers, and thus increases the rate of absorption. Next is insulin glucin. Again, I have displayed the structure of insulin having the A chain of 21, and third next is the 30. But here we find the two changes are made at the two extremes. Just have a look. It is the B29 position. We have the substitution of glutamate, and the third position where lysine is substituted. So, it is the third position as well as the 29th position which is going to shift the equilibrium away from hexamer formation, that is towards the dimer or the monomers, and then the rate of absorption that is going to be increased. Insulin zinc suspension, I will be talking about the official preparations, but I just want to mention here that this type of the insulin is not for the intravenous injection, because when we talk about the insulin, the first thing that strikes our mind is something which is to be given by the parenteral route. There are three types, that is lannate, semi-lannate and ultra-lannate. Semi-lannate has a particle size of 2 micrometer. Low concentrations of zinc, they are used to form the precipitates. Ultra-lannate has a particle size of around 10 to 40 micrometer. So, high concentrations of zinc that is used to form the precipitate, and in lannate we have the combination, that is a ratio 70 to 30% mix is done to give both the ultra and the semi. So, what changes we are making is just to increase the rate of absorption and to increase the duration of action as per required. So, depending upon the requirement, we try to make changes. I have just tried to list certain type of the insulin to make you clear that how we make the changes, though I will be talking each of the preparations which are official and tell you that what changes we are making and why we are making, of course to increase the duration as well as to increase the rate of absorption. First is the quick acting, such as the insulin analog, that is Lispro, just talked about, begins to work within 5 to 15 minutes and is active for 3 to 4 hours. Short acting, such as regular insulin, starts working within 30 minutes and is active about 5 to 8 hours. Intermediate acting, such as NPH or lannate insulin, starts working in 1 to 3 hours and is active for 16 to 24 hours. Long acting, such as ultra-lannate insulin, starts working in 4 to 6 hours and is active for 24 to 28 hours. Glargine starts working within 1 to 2 hours and continue to be active without peaks and dips. That means it is not that when the absorption is complete and you will get the maximum height, and when it starts degrading and there will be a dip, it will be the same, it will be persistent, stagnant, and a constant maintenance will be done for 24 hours. A mixture of NPH and regular insulin starts working in 30 minutes and is active for 16 to 24 hours. There are several variations with different proportions of the mixed insulin. So just have a look at the first preparation. We find that the begins between 5 to 15 and then prolongs for 3 to 4 hours. That means duration is this much. We make certain changes and the onset no doubt increases 30 minutes but is active for 5 to 8 hours. Intermediate, that means what we have seen from the first to second to third to fourth, that is 5 to 15, 3 to 4 hours, 30 minutes, 5 to 8 hours, 1 to 3 hours, 16 to 14 hours, 24 hours, 4 to 6 hours and 24 to 28 hours, 1 to 2 hours for 24 hours, 30 minutes, 16 to 24 hours. So it is just the combinations that we are working. We are just working because what we are actually doing is breaking the hexamers to monomers and dimers so that the rate of absorption that is going to be increased, which is exactly required. The different type of the terms you will come across in your books or wherever you study is what I want to explain you here. For example, human insulin EMP. What it is? It is produced by the enzymatic modification of insulin obtained from the porcine pancreas. It is also sometimes called semi-synthetic human insulin. Then is human insulin ERB. It is used for insulin produced by the chemical combination of A and B chains, which have been obtained from bacteria genetically modified by recombinant DNA technology. Human insulin PRB is produced by proinsulin obtained from bacteria genetically modified by recombinant DNA technology. Human insulin PYR is insulin produced from precursor obtained from the yeast genetically modified by recombinant DNA technology. So you just see we have PYR, PRB. In PYR it is obtained from yeast. In PRB it is obtained from bacteria. ERB it has been obtained from bacteria. Or EMP it is produced from the enzymatic modifications of insulin. So whether it is EMP, ERB, PRB or PYR, the sources may be different, but all of them they have been genetically modified by the recombinant DNA technology. I will be talking about the official drugs of insulin. Till now I talked about the different type of the preparations. No doubt our main aim is to talk about the official preparations, but we should know what are the different sources, what are the different type of the modifications that we do to increase the rate of absorption and duration of action. Coming to the first and the foremost that is official is insulin BP. It is the natural anti-diabetic hormone obtained from the pancreas of either the pig or the ox, and the purified insulin is a white or almost white powder, practically insoluble in water. The molecular weights of insulin and bovine insulins, they are 5778 and 5734 respectively. Insulin should be stored at a temperature 2 degree to 8 degree and used for the manufacture of preparations within a short period of time. Human insulin BP, it is a protein having the structure of anti-diabetic hormone produced by human pancreas. It is produced either by enzymatic modification and suitable purification of insulin obtained from the pancreas of the pig or by the method based on the recombinant DNA technology. It has molecular weight of 5808. You just see the difference. Here we had a molecular weight of 5778 and 5734. I just want to repeat because the students must have this feeling that we are talking about the insulin, and that is also obtained from the pig. And what is the difference between insulin and the human insulin? So this can be obtained from the pig and this can be produced from the human pancreas. So its molecular weight is 5808. Next is the insulin injection, official in British Pharmacopoeia as well as Indian Pharmacopoeia. Soluble insulin, also called like this, that is another name of insulin injection. It is a sterile acidic solution of crystalline insulin containing 20, 40 or 80 units per ml. It contains not more than 40 micrograms of zinc for each 100 units of insulin. It contains sufficient of a suitable substance such as glycerin to render it isotonic with blood. The different proprietary names are given. These proprietary names you will be coming across for each preparation. Want to do it, so you can just go in for it. Next is the protamine zinc insulin injection, which is official in Indian Pharmacopoeia. It is a sterile buffered suspension of insulin in the form of a complex with a suitable protamine and zinc chloride. It deposits a white sediment on standing and leaves an almost colorless supernatant liquid. It has pH of 6.9 to 7.5 and is rendered isoosmotic to blood. The effect of injection starts in about 4 hours and persists for 24 to 36 seconds. Isophane insulin injection, which is official in BP as well as IP. The common names we come across of such preparation is isophane protamine insulin injection, or we can just call it isophane insulin. It is a sterile buffered suspension of insulin in the form of complex obtained by addition of protamine sulfate or another suitable protamine. It contains 300 to 600 micrograms of protamine sulfate per 100 units of insulin, pH 6.9 to 7.5. It is an intermediate acting preparation. Its effect starts within 2 hours and lasts up to 24 hours. Globin zinc insulin injection, official in IP. It is a sterile preparation of insulin in the form of complex formed by the addition of globin and zinc chloride. It is almost colorless liquid, substantially free from turbidity, from matter, which deposits on standing, has pH between 3 to 3.8. It is available in strengths of 40 to 80 units per ml. It should never be given intravenously. It is given subcutaneously. So such things are to be kept in mind. So if you talk about the insulin, this thing does not strike your mind or should not strike your mind that it is to be given by in IV route. It can be given parenterally, preferably 30 minutes before the breakfast. Its effect starts within 2 hours and lasts for 18 to 24 hours. Insulin zinc suspension, that is BP-IP, both pharmacopoeias, they have this, so it is official in both. A common name that is called as insulin zinc suspension mixed, also called as by the name IZS, insulin zinc suspension, or another name that is insulin lenit. It is a sterile buffered suspension of insulin in the form of a complex obtained by the addition of a suitable zinc salt. The insulin is in a form which is insoluble in water. It is insoluble in water but has pH of 6.9 to 7.5. It is a sterile buffered suspension. Now, just have a look. This preparation is insulin zinc suspension, official in BP and IP, because it is mixed of what? Amorphous and crystalline. Fine. So, both of them, rather three of them, whether the mixed one or the crystalline one or the amorphous one, all of them, they are official both in BP and IP, but the only difference that we come across is, just have a look, it is 12 to 16 hours, and the previous slide we said that the pH is going to be the same, but I had not mentioned the duration. It is a sterile buffered suspension of insulin in the form of a complex obtained by addition of a suitable zinc salt in a manner that the solid phase of the suspension is amorphous. You have seen that the pH is on all the cases of the insulin is found to be 6.9 to 7.5. Its effect starts in about 1 hour and lasts for about 12 to 16 hours. Coming to insulin zinc suspension, this is crystalline. It is the insulin zinc sterile buffered suspension of insulin in the form of complex obtained by the addition of a suitable zinc salt. The insulin is in the form of crystals, insoluble in water. It is a white suspension which on standing deposits a white deposit and leave a colorless supernatant liquid. pH same 6.9 to 7.5. Begins in about 4 to 6 hours, lasts for 3 to 36 hours. In your previous slide, I said this is called as IZS. This is insulin zinc suspension. This is also called as IZS but amorphous. Time is 1 hour and lasts for 12 to 16 hours. Come to the next, also called as IZS crystalline. Starts effect from 4 to 6 hours, lasts for 30 to 36 hours. So, depends upon whether we are talking about the amorphous or we are talking about the crystalline, the duration, the onset, the effect, that is going to be drastically different. Biphasic insulin injection, official in BP and IP. It is a sterile suspension of crystals containing insulin bovine in a solution of insulin porcine. The preparation is a white suspension which has pH 6.6 to 7.2. It combines the properties of a quick acting insulin with the prolonged action of the crystalline component. It is given before breakfast subcutaneously. Its effect begins within 30 minutes and lasts for 18 to 22 hours. Biphasic isophane insulin injection, official in BP. Another name, that is a common name, biphasic isophane insulin. It is a sterile buffered suspension of porcine insulin or human insulin complexed with protamine sulfate or other suitable protamine in a solution of porcine insulin or human insulin respectively. It is a white suspension which on standing deposits a white sediment and leaves a colorless or almost colorless supernatant liquid. pH 6.9 to 7.5. So, till now we talked about the different preparations, whether they were official, whether they were non-official. Coming to the preparations other than insulin, the second category, because my topic is insulin and oral diabetic drugs. Both of them, they are used in diabetic mellitus, but we have talked about the insulin. Coming to the second category is the oral anti-diabetic drugs. They have been classified into different categories: sulfonylurea, thiazolidinediones, biguanides, alpha glucosidase inhibitors, and magnetinides. Amongst this, we find sulfonylureas are most widely used. They have been